Hey team, Dr. Josh Wagner here. I am currently stuck in LAX for an extra 2 hours and I've heard this question and issue come up a bunch in the past month. So I'm going to speak for a few minutes and give you a totally different perspective if you have trouble getting paid what you're worth, getting paid for your recommendations, getting paid for your chiro care or whatever other care you recommend, and are not generating the practice collections or income that you deserve. So here's what it comes down to. There's a couple of reasons why chiropractors struggle. One, from the care perspective, is we want something differently than the patient wants. Typical chiropractor is we want patients to get well and stay forever and be a chiro advocate and be a lifelong wellness patient. And that's good, and I support that and I agree with it. But the typical new patient comes in and just wants to get better with their current condition. And there's a huge difference in that. It's kind of like if you go in any store and you know what you want and they're trying to sell you something different, it's tough. So that's one of the biggest things we fix, and we show you how to mend inpatient mastery. But let's push that to a side. When it comes to actually getting paid, the bigger issue with chiropractors is how we view, is our chiropractic care valuable or expensive compared to how the patient views, is chiropractic care valuable or expensive. Now, we look at it totally different from the patient. As a chiropractor, we oftentimes justify our fees based on what we learned in school, based on what insurance companies has taught us, based on what coaching groups has taught us. We think we have to justify our fees on number of visits, the amount of time we're taking care of the person, the number of services we're giving, the amount of time we spend with the person, all of that stuff, which the patient actually doesn't care about. I tell docs all the time, just to start cracking open their mind and having a light bulb go on, patients would rather pay you twice as much for half the amount of care in order to get the same result. And it's true. And at first thought, you're like, wait, that doesn't make any sense. Why would patients only want to pay twice as much for half the amount of care? Because no one wants to pay for care. They want to pay for the results. And if you can get them the results in half the amount of care, that's half the amount of times they have to show up to your office, they get the results quicker, they're happier, and it's longer lasting. And that's not saying there isn't room for continued care after that. We're talking about the paradigm initially. So the big main flaw is that chiropractors charge based on their perceived value of services and quantities and numbers and all the doing to get the patient well. And you're constrained by your colleagues' fees, the professional's norm fees, your mentor's fees, what insurance says is the right thing to charge. But that's not what patients, who are the ones paying, actually want to pay for. So you want to know how to make it a lot easier for yourself and patients, and everyone's happy and you get paid a lot more? If the patient wants to pay for getting improvements in their health, getting out of pain, restoring their health, getting over a condition, if you start focusing on charging for that, and by the way, this doesn't mean that you have to guarantee a result. This is healthcare, you're a doctor. An oncologist isn't guaranteeing a result. You don't have to, and your patients aren't expecting you to. Okay, leave that alone. But when you start positioning your care, a specific protocol for the condition that they want to get better, to get them back to their life, and most likely this is going to last for years, decades, or the rest of their life, and you start thinking about what's the value of that, I guarantee there's no amount you're going to choose that you feel comfortable getting reimbursed for and invested in that's going to be equal or higher than the value of that patient getting their life back, getting out of pain, being able to do the things they love, being with their family, not having the looming, lingering health ailment always on their mind. And it's your choice. If you want to charge based on services, and I'm not saying there isn't a way to calculate your fees, and I'm not saying doing anything that's not compliant. I'm talking about the mentality. If you're picking what you want to get reimbursed by how many visits you have to throw in a plan, or how many services you have to throw in a plan, or how many minutes you have to spend with the person, your care becomes very expensive and unattractive to new patients who are in pain and want a trusted leader to get them better. However, if you choose your rates and your fees based on protocols to help people with different conditions get better and get back to their life, People want it, they're willing to pay, they understand there's no guarantee, they understand pay out of pocket is norm because insurance is a nightmare, and you'll get compensated, reimbursed, and paid straight out of pocket from patients more than you ever have in your past. And you don't have to make up visits and care plans and protocols and services that you don't necessarily believe in just to validate a care plan fee, which is the old model, which causes a lot of incongruency in chiros, which then causes a lot of new patients to be skeptical, not refer, not start, or not continue. So when you switch this mindset, patients are looking at your care as expensive if you're justifying your care based on the deliverables. Patients see your care as valuable if you justify your care based on expected outcomes. Not guaranteed outcomes, doesn't matter. Why? Because patients know it's bullshit if you're guaranteeing it, because this is healthcare. Be honest, be truthful, and they'll respect that more, trust you more, and be happy to invest and get the results they're looking for. You could be honest and win, and your patients win. That's patient mastery. Take this to heart, set your fees based on the difference you're making in patients' lives. If you need help personally with this, that's exactly what we do, from the first phone call to patients handing their credit card, referring, and staying with you for well longer than just getting their life back, because there's a transition for that too. All right, be well. I gotta get to a flight. Keep up the great work, keep helping people get well. Have the practice you deserve. If you need help, personal help, reach out, send me a message, and just say ready.